Hi, I'm Pat Gallagher, CEO of PGT Trucking. We started the company in 1981 with a combination of 2 employees and 2 trucks. Today in 2017, we're running close to 1,000 trucks and drivers throughout the United States. Here to talk about the rising cost of medical care. We know things have changed since 1981 to present, and my job is to ensure that my employees have the best possible medical care they can have at a reasonable cost. We've maintained our costs over the last 5 years, and that's my job, is to make sure that we continue to look at ways to save money for our employees. Some of the benefits we have at PGT: we have a corporate chaplain on staff. His job is to reach out to our people to balance both their professional and personal life, and more importantly, that's the message we're sending, is that I care about my employees. So over the next few months, we will be reaching out to each and every one of you to offer you many choices along the medical benefits and programs that we have, which will be best for you and your family. So as CEO of PGT, I can assure you that we're working at a highest level to make sure we control your medical costs and give you the best possible benefit. Thank you, and God bless.
Employees are eligible to participate in the benefit program the first of the month, following 60 days of employment. You must enroll in our benefits prior to your effective date. Once your effective date has passed, you'll need to wait until our yearly open enrollment period to make any changes unless you experience a qualifying life event, such as a birth of a child, marriage, or divorce. Should you experience a qualifying life event, you must notify the insurance department within 30 days of the event. Even if you don't want to make any changes to our benefits, you must re-enroll in your benefits annually during our open enrollment period. After enrolling in benefits, you will receive 1 medical prescription card for each person you have enrolled on the plan within 15 days of the effective date. PGT offers 4 medical plans to employees. Each plan is slightly different, so employees can pick and pay for the insurance plan that fits the needs of you and your family. Employees who commit to being nicotine-free will receive a $20 per month reward to help reduce the cost of their medical premiums. Affidavits must be filled out yearly to receive the discount. If you are a nicotine user and would like help quitting, you can complete a free nicotine cessation program with your medical carrier. Plans A, B, and C offer deductibles from $750 to $1,250 for single coverage and low copays for office visits. All 3 options have varying levels of coinsurance. There is a $75 annual prescription drug deductible. After the RX deductible is met, you will pay 30% of the RX cost to a maximum of $50. Plan A has a $1,250 deductible for a single payer and a $2,500 deductible for a family. Once the deductible is met, the plan will pay 70% coinsurance, and you will be responsible for 30% of services after the deductible is met. Plan B has a $1,000 deductible for a single payer and a $2,000 deductible for a family. Once the deductible is met, the plan will pay 80% coinsurance, and you will be responsible for 20% of services after the deductible is met. Plan C has a $750 deductible for single payers and a $1,500 deductible for a family. Once the deductible is met, the plan will pay 90% coinsurance, and you will be responsible for 10% of services. Plan D is a qualified high-deductible health plan. This means members pay the full deductible prior to insurance kicking in. Once the deductible is met, the company will pay for 90% of all health expenses, and the employee will pay the remaining 10%. If you enroll in a qualified high-deductible health plan, or a QHDHP, you are able to participate in a health savings account, also known as an HSA. The health savings account allows you to save money on a pre-tax basis in an individually owned bank account. Each year, the IRS determines the annual maximum that an employee can contribute in an HSA account. In 2018, a single employee can contribute $3,450 in their HSA account. If a family is enrolled in a QHDHP, you can contribute $6,900. If you are 55 or older, you can contribute an additional $1,000 in catch-up contributions. The funds in these accounts belong to the the employee, and there is no use it or lose it provision. QHD-HP plans help promote healthcare consumerism. Just as you would investigate the features and prices of flat-screen TVs prior to purchasing one, we want you to take the same time and effort into coordinating your healthcare. All plans cover preventative visits and services at 100%, so there is no cost to the employee or their family. We encourage every member on the health plan to have a relationship with their primary care physician and complete all recommended preventative visits and tests. Health awareness goes beyond medical exams. Eye exams can not only identify if you need corrective lenses. Eye exams are an important part of preventative care. Diseases such as diabetes, hypertension, and glaucoma can be diagnosed early with an eye visit. The Vision Plan allows you to get an eye exam, lens, and frames every 12 months. Just as it is important to go to a medical preventative visit yearly and get routine eye exams, bi-yearly dental exams are an important part of maintaining your overall health. Many studies show there is a correlation to good oral health and reduced risks of diabetes, arthritis, stroke, and heart disease. Our dental program covers preventative services at 100%, basic services at 80%, and major at 50% to an annual maximum of $1,000. Orthodontics for dependents to age 19 is covered at 50% to a maximum of $1,000 per person. 2 cards will be issued for dental coverage. Both cards will have the employee's name listed, even if you cover your dependents. When your medical insurance is effective, the company will provide you with a $50,000 life insurance benefit, your spouse with a $4,000 benefit, and children over 6 months old to 20 years old with a $2,500 benefit at no cost to you. Additional life insurance may be purchased on a voluntary basis in increments of $10,000 up to the less of 5 times your annual salary or $500,000. Employees will automatically be approved for up to $150,000 in voluntary life insurance the first time they are eligible. If you wish to enroll in life insurance after you are first eligible, or if you wish to elect an amount over $150,000, you will need to complete an evidence of insurability form with the life insurance carrier. You may also purchase additional life insurance for your spouse and dependents. Long-term disability provides sound financial protection in the event of a disability. The benefit pays 60% of your weekly. Benefits kick in after 90 days of a disability. This is a free benefit to employees provided by the company. In addition to the employer-paid benefits, the company partners with Aflac to offer a variety of voluntary worksite benefits. These benefits are 100% employee-paid through post-tax payroll deductions. There are a variety of benefits offered to help you supplement the cost of medical care should you experience an accident, critical illness, or hospital stay. The benefits paid through the worksite program are paid directly to you and can be used however you'd like. Our company not only focuses on health awareness, we are also focused on financial awareness and understand that financial obligations can have a negative impact on your health. Our company is pleased to offer an industry-leading 401k program. You are eligible to participate the first month of the quarter following your hire date. You can put in as much as you can afford to put in, to a maximum of $18,000 per year. If you are over 50, you can put in an additional $5,500 for a total maximum of $24,000. These deductions will be pre-taxed. The company will match dollar for dollar up to 5% of your gross earnings. We thank you for watching. If you have any questions on your benefits, please contact the insurance department.